Hello, and welcome to GAPNA Chat, an official podcast of the Gerontological Advanced Practice Nurses Association. GAPNA Chat provides interviews and discussions with GAPNA leaders and members of the gerontological healthcare community, and will focus on advocacy, policy, education, professional development, research, and clinical care for older adults. Before we get started, a practical guide for the gerontological specialist is now available for purchase in the GAPNA store. This text is a handy resource for anyone caring for older adults and is helpful to those preparing to sit for the Gerontological Specialist Certified exam. Visit www.gapna.org to get your copy. In this episode, Dr. Cassandra Von Ness, a gerontological nurse practitioner and member of the GAPNA communication team, talks with Dr. Carol Ziegler, a professor of nursing at Vanderbilt University School of Nursing in Nashville, Tennessee, and a co-founder of the Climate, Health, and Energy Equity Lab. We are pleased to present Dr. Von Ness's interview with Dr. Ziegler.
Hello, this is Dr. Cassandra Von Ness with GAPNA Chats, and today we have with us Dr. Carol Ziegler to talk about planetary and global health with us. Dr. Carol Ziegler teaches in the Family Nurse Practitioner and the Doctoral of Nursing Practice programs at Vanderbilt University. She is a co-founder of the Climate, Health, and Energy Equity Lab, or CHEEL, C-H-E-E-L, and holds secondary appointments in the Arts and Sciences Department at Vanderbilt Institute for Global Health. She is dually certified as a family nurse practitioner and an advanced practice holistic nurse. Dr. Ziegler is the Vanderbilt liaison for the Nurses Climate Challenge and chairs the American Nurses Association Planetary and Global Health Innovation Committee. Thank you, Dr. Ziegler, for joining us today.
Thank you so much for having me. I'm so happy to be here with you.
So I always like to start out with a reflective question. So make us think a little bit and get to know you. So knowing where you are right now in your career journey, what would you tell an 18-year-old Carol about what lies ahead for her during her nursing journey?
Oh, I think that it's beyond her wildest dreams. What lies ahead? I think I would first tell her parents were mostly right about most things. And just to stay open, I think I wasn't nursing, I came too late. I was around 30 when I came to nursing. So I was a nutritionist before. And that really is kind of, now looking back, I was always right where I needed to be where I am now. So I like to tell young people whenever you're somewhere and you're doing something and you kind of feel stuck, just know it's preparing you for the next thing. And then when you get there, you'll realize, oh, wow, I went through all that so that when I got here, I could be helpful to this person or to this person. And so I just think it's a wild journey. I think also I would tell her, and I get this from Tabitha Brown, who's one of my heroes. She's a vegan chef. She always says, what other people think of you is none of your business. So I think I also wish I had, as a young person, I had not cared so much about what other people were thinking. And I had just kind of moved forward with what I wanted to do. Yeah.
That's hard to do these days with all of the social media influences. So that's another reason why we don't want to have to go back to being 18 again.
That's right.
So tell us, how did you first become interested in the impact of global and planetary changes related to our older patients?
Well, so I think as a young person, my father was a civil engineer, but he worked in environmental systems. And so, I was always exposed to that at dinner conversations at home. He would talk about, pollution and water systems and things like that. And then as a recent nurse graduate, I went to Kenya. I met a student here, ended up marrying. And so it was not a global health trip. It was just we're going to go visit the in-laws kind of trip. So I went to Kenya and I realized when I was there, I was meeting these people who were centenarians. There were so many centenarians, probably 12, 13, right? In this one village of about 700 people, and I would meet a woman who was in her 80s and she'd be like, oh, I want you to come meet my aunt. And I'm like, wait, what? How is this possible? Because I was an NP in Nashville. The life expectancy of my patients here was much, much lower than that. And so I realized there's all these very healthy older people here, and they're not identified as a blue zone, right? Because no one's studying them, but they're clearly a blue zone. Then I also noticed, so down the road when I was doing my DNP, because I had been going back and forth a lot, actually the reason I did my DNP is because there was a group of traditional healers there. And they said, hey, there's no one coming up behind us. We need someone to archive this knowledge that we have. Would you do it? And I was like, absolutely. So I came back to Nashville, VIGH, right, which is where my other appointment is. I talked to a nurse mentor of mine there, Carol Etherington, who was a psych nurse who did a lot of work in Nashville. And she said, why don't you do your DNP? And that could be your project. So that ended up being my project. And in that role, really meeting with these healers who were all over, late 60s, which is, middle-aged, right to them, they had already very clearly identified the changes in the migration patterns of birds, the reason that, the deforestation was causing changes in rainfall patterns. They had these massive tree planting campaigns going on, which I think Monday actually of this year, Kenya declared a national holiday so people could plant trees. So they planted like hundreds of millions of trees this Monday, just now. And so I realized both the health impacts, the justice implications, because these are all people who don't have electricity, they're burning charcoal, they're living very sustainably, getting no credit for that, right? No one notices. And the elderly people, while healthy, were, it was hotter some days. They're noticing these health impacts. And so I think that's when I really realized, wow, this is really unfair. And this is really a nursing and health issue. And also the traditional healers, there was this shared language that we have that I think, if you go on vacation anywhere in the world and you meet nurses, there's like this shared language and this, I'm going to say sisterhood, brotherhood. There's a wehood that sort of happens, right? And I kind of had that with them as well. So I think nurses are such good messengers to connect the health impacts to this very sort of abstract, nebulous concept where if you just hear it, it feels political or it feels like it's too big. But when we can be like, no, the forest fires in Canada impacted this child's asthma, we're really the best messengers to get that across. So that is my long story for how I got into this work.
And this was all over the course of what, the last 10 years or 15 years?
15 years, I would say. It's been a while. And I think too, as a new, I graduated from the FNP program in 06. And so then I was, in 09, I was over there. So I was still kind of getting my feet, you're kind of getting used to practice and just trying to do your best as a clinician. I don't think I felt empowered to do much until like the last 10 years or so. And then I've met other nurses who are involved in the same work. So, you start to build coalitions and then you can really get stuff done. So, yeah.
Did your holistic nursing interest happen as a result of these trips to Kenya, or was that an interest before?
That I would say, so I did nutrition before. So I was actually a registered dietitian, worked in Scott County, East Tennessee, in the Appalachian foothills. And there was a lot of, again, it was all older people, folk medicine practices I learned about while I was there, which were fascinating to me. Then in Nashville, a lot of the older patients I see had folk medicine practices that were like Southern that they would share with me once they trusted me. So I think it was a budding interest. And then definitely, yes, when I went to Kenya, I just saw the effectiveness and also learned sort of in my work there that most of the medicines we have, like 80 to 90% were originally discovered by some herbalist somewhere, some healer somewhere, right? So I realized those connections. And then I think I drew the connections between planetary health and holistic nursing, and then just learned there was this advanced practice certificate. So I completed that maybe 2 years ago, just to kind of, as a way to direct my own continuing education and kind of try to bring this into practice in a way that was more formalized.
That sounds so interesting. So this brings you to last year when you founded the Thrive Community Healing Cooperative.
Yes.
And that's providing the home-based holistic primary care and the health coaching to families. So
yes.
this was a really good opportunity for you to utilize that holistic advanced practice role. Can you tell us a little bit about that project?
Yeah, so and it has grown legs and moved since that. So I was a nurse practitioner at Meharry Medical College in the family clinic from a couple days after I graduated until September, I think, of 2021. I was there, a wonderful place, loved the patients, great collaborating physicians, had just a really wonderful experience. But I got, during COVID, we all got kind of burned out. Many of us did. And I got really frustrated with just the current healthcare system, the insurance, all the time we all spend dealing with claims and not in front of the people we need to be in front of. And I was, I care for a population that has a lot of social determinant issues and challenges. And so I left and I was like, I'm going to start this practice. I was just seeing patients in their homes. And this is kind of where, again, the planetary health practice piece comes in. So I have a dear friend and colleague named Kimberly Jackson, who does indoor air quality testing and remediation in homes for low-income families. So we teamed up. We're putting these purple air monitors in people's homes, especially in people who have children with asthma, so they can see in real time if they're doing something to make the air quality worse, right? So we started doing that. And so that's why for me going into the homes is so important. So I was doing home-based care, and then was invited recently to open up a pilot clinic in NICE, which is the Nashville International Center for Empowerment, which is a refugee relocation organization here in Nashville. So that practice was going to launch November 1st. But they said, wait, we're going to actually build you a bathroom inside the room where you're going to be. So they're spending money on me. So they're going to build out the room where they were going to have me see patients. They're going to put like a sink and a toilet and all those wonderful things. So that's where I'm going to be based. I didn't have like a home. So I will see their resettled clients, and then I'll still see the patients that I was seeing before the Meharry.
Oh, that sounds excellent. Is transportation an issue? For your patient population getting to, I can see when you went to visit them, is that going to be a challenge for some of your patients, a barrier to coming and seeing you?
Well, I will still go to homes. So
Oh,
part of the
okay.
plan is, I ran into all these barriers to starting a business. So I realized how hard it is for us to start our own practices. We have a lot of work to do to break those down. One of the challenges was, if you're going to take state insurance, right, you have to have a certain number of exam rooms. You have to have a separate address. So I couldn't use my home address. So NICE is letting me use that as a business address. And then I'll see their clients there when they come to the center and still see mine in their homes. If they need to come in because they need like an invasive procedure, they can come. But I'll still probably do predominantly home-based care. And as part of that, also the CHIL students calculating for me, what is the carbon savings, right? If I drive to a complex and see 10 people versus if those 10 people all came separately to the clinic. So we're trying to find ways to sort of quantify all the different benefits that this kind of practice could create to really ultimately remove barriers for APRNs to practice.
That sounds like great work you're doing in Vanderbilt. So I was looking at some of your publications because I wanted to understand about where we've come, and you identify some of the impacts that you've identified in primary care. And when we look at, you've mentioned Kenya, when we look at the global impact on older adults, is that evenly distributed between, our European older adults and what we may be seeing in North America or South America? What have you identified?
So typically what we see, and this is, I would say, even within, so we think about global health, right? It's typically the global South, where all people, including older people, have the greater impacts. But even within zip codes, we see these huge disparities in impacts, right? So like in my zip code here where I am, a few blocks from me, based on income and especially energy access. So like in Nashville, access to air conditioning, a lot of public housing units especially don't have air conditioning. It's not mandated. So if you think about a person, an elderly person who's in a unit without air conditioning and say they have heart disease, hypertension, COPD, just sort of the burden that puts on them, plus the air quality burdens. So yes, across the globe, we see that typically the global north, people tend to do better just because the main health impacts are heat and air quality that really cause the most damage. And then also, if you think about extreme weather, a lot of times older people, especially in the global south, don't have the means to move, right? Or the resources to be resilient. And so where in a lot of communities in Europe, I think people just have more resource. But I do want to just stress that even when we think about like North America, even within North America, within a zip code, there can be 10, 12-year difference in life expectancy just based on resources. So I don't want to give the false impression that everyone in the US is safe, right? Because that's also not the case. Yeah.
And, and you think about how different we are, how diverse between the populations in California and their
Absolutely.
exposures, or as we move to out of the industrial Northeast, and people that working in, I come from Kentucky, and we look at coal mines in West Virginia and the Pittsburgh area and the factories that certainly impacts the health.
Yes, and cold
of our
too,
older
right?
adults. Yeah.
People, if they're experiencing energy poverty and they don't have heat, for sure, it's a huge risk.
So when we look at the local health impact, so tell me how the Climate Health and Energy Equity Lab starts to identify some of these components that we've talked about, and how do we mitigate those local impacts? I mean, short of, reducing your carbon, footprint with travel and patients, how else are you trying to mitigate those climate changes?
The two colleagues I work with, one is Dr. James Mushira, who was a PhD nurse. He's actually originally from Kenya at the School of Nursing at Vanderbilt. And then Zdravka Zankova, who was a sociology professor there, who is now the head of the new climate studies major. And Zdravka and I came together the last couple of years over this frustration that I mentioned earlier, which is that people who have really low carbon footprints by virtue of their lifestyle really have the highest burden from the health impacts of climate change. Meanwhile, companies are trading in carbon offsets. There's all this money floating around, and it's not going into these communities where people are really making sacrifices, right? And so the Chill Lab is really designed to find ways to drive those carbon offset dollars into these communities to impact their health. So we live in that co-benefit space. And co-benefits are areas where health practitioners, especially NPs, in my opinion, can really drive home ways to both positively impact planetary health and human health at the same time. And we, interestingly enough, had our students kind of research local climate impacts, research carbon offset markets, research, planetary health issues, and they come up on their own with the top 4 ways locally we can impact health. Those just so happen to align with sort of the international guidelines. And so we were really happy about that. And those ways were food and food access, transportation, housing, and healthcare. So those 4 areas. So we have 4 groups working now, well, starting last year, and they've transitioned now to some other projects. But the projects that are really taken off, the first one is housing. So, as NPs and nurses, we know how much housing impacts health and access to clean air, and also how the cost of housing that cost, the rent eats first, people say, right? So people will pay rent before they'll buy their medications because they have to. And so there's been all these studies done that show if you weatherize a home and decrease someone's energy cost burden, they then have money and their health improves because they can buy medications, they can take their blood pressure bills, they can make their appointments. So we're working with a church in Nashville, in North Nashville, that has for years, as part of their ministry, been renting housing units to low-income families for below HUD rates. And I have to also mention, Nashville is one of the most rapidly gentrifying communities in the country. So we're seeing a lot of movement, especially of older people who've owned their homes, they're being pushed out, right? And so this is really an important piece of why we chose this partner. And so we have students researching how weatherization would both improve health and decrease energy costs, and thereby decrease carbon emissions as well, right? For the families that will rent there. And so they're actually packaging a social carbon offset to sell to companies in Nashville that need to improve their reputations. So we'll say, like, for example, we have 2 companies here that get a lot of bad press for displacing people at Oracle. I don't even know what they do in Amazon. And so they're packaging these carbon offsets to go and say, hey, Amazon, will you pay for Westwood Church to install these energy efficient windows? And here's the carbon offset you can get. And here's the social benefit. You're helping a historically Black church in a gentrifying community, like, help the community. And so, because they're not eligible for like Barnes Housing Fund because they're a church. So we're trying to find ways the students can kind of have an impact. Another group, a group is working with me on the lower emissions associated with home-based primary care, including like avoiding emergency rooms because they're carbon intensive.
Yeah.
Another group is working on promoting breastfeeding for moms. So they're looking at their difference in emissions and health benefits for supporting mothers to meet the AAP recommendations for extended breastfeeding. Like, what does that look like? How can we quantify that? So in all these areas, we have students really looking to align the co-benefits with the local markets here to really sort of bring health benefits to the community.
So when we're changed the terminology from just limiting it to, global warming,
Yes.
and climate change, to really planetary health,
Yes.
to be sort of a more, holistic term for everything. This doesn't have any political offshoot. You're not running into any political barriers in your community.
So I think we kind of moved away from that. And also because it's not just, when you go to, like, if I go to people in rural communities who don't look at things that way, they certainly see flooding happening, right? Especially agricultural communities.
The extreme weather patterns we're seeing right across Tennessee. You've gotten a lot of that extreme weather.
Yes, and I think the language has been so divisive that people just feel excluded from the conversation. So if I go to a community and say, like, I'm not going to even use that word because that word is irrelevant to us right now. What's relevant is you guys who grow who grow our food are being impacted by this. Your health, your families, people lost their homes, they lost loved ones, like in Waverly recently with the floods a couple years ago. So people understand that language. I think also everyone gets that, when there's forest fires, they're coughing more, the air quality is worse. And so I think the planetary health model, everybody can get behind. It's very, if you look at the Sao Paulo Declaration, it has very clear directives for business, for the arts community, for universities, for healthcare and the health sector. And so I just think it's a very inclusive way that everybody kind of sees where they fit. And it's not so sort of gloom and doom.
Yeah. and that was smart because words do matter.
They do.
And using the wrong terminology just closes off, half of our population. So that was very, very smart. So when we're talking about educating us, other healthcare providers, and your community members, what are some strategies that you have? I mean, I know getting the student involvement, but how do you educate other members about, including this in their holistic picture of care for the geriatric patient?
I think this right here, like what you guys are doing is huge. Just giving platforms to people to talk about it and get the word out is huge. I presented like at AANP, we presented at meetings and things like that, write papers, of course. There is a move now. I know Vanderbilt School of Nursing has done this. We've kind of embedded planetary health in our core courses. So the all levels of students have to kind of come through these core courses and they take these courses together. So I think embedding it for students across curriculum is really important. And then there's some great resources like the Planetary Health Alliance is fantastic. If you just go to that website, they have links to the Sao Paulo Declaration, which is like the universal declaration on planetary health. What is it? What does it mean? How do you do it? They have pre-baked presentations. So like tomorrow I'm going to give a talk at Vandy at this engineering conference, nature conference. And I was like, well, I could just really use that. And it's free, fair use. And so there's a lot of resources there. There's ideas for coursework that we can use. But I think educating ourselves about it within our schools, like first step for me is really to educate the Vanderbilt faculty about what it is and what it means. Then when I get these wonderful invitations to come and talk, I will always say yes. I'll always say yes. But I think those are the main ways. And then if we can get the students on board, they are the amplifiers, right? They will go out and they all know how to use Instagram and do all these tech social things. And so I think getting students on board is powerful. I also think as educators, if we can embed within our coursework assignments that are public facing, so like having students write an op-ed as an assignment or create a podcast or do a social media post, I've seen that done. I think that's a powerful way to kind of both showcase nursing's leadership in this area because we're really the best ones. Because it's the nursing meta paradigm, right? I mean, planetary health aligns perfectly with the work we do. That we really
sure does.
We've kind of lost our way. I think because we're always trying to prove our worth to doctors, and we should stop and just do the thing that we do great. And so I think highlighting those connections is really important as well.
And we know that there's lots of things that, just doesn't get fixed with a prescription.
Absolutely.
And
Absolutely.
we try so hard to go toward a medical model that we, it's like you said, we've lost our way and forget about the foundation that really Florence taught us, that we built nursing on. I'm very happy that we're even getting away from an acute care model so much and looking at communities, because from fixing to promotion is important in prevention. So do you have any parting words, an elevator speech that you would like to leave our audience with today?
Yes, I would say please go to the Planetary Health Alliance website, go to the Alliance of Nurses for Healthy Environments website. That's a great group, and just get educated on what this is. and think of ways to implement it in your practice. You can share my email. I'm happy to communicate with anybody about this. This is what I kind of live, breathe, and work. But also I want to suggest that I really believe nurses are the key to rolling these things out, because we are the interface. We can speak to the science, the theory behind it. We can also speak to regular people. We're so good at that, right? And people trust us. We're always the most trusted profession. So I want to really encourage us to get educated about it, and also leave these big systems and start our own practices. Because I really think that if the barriers were removed, nurses are so innovative, right? I mean, are just amazingly innovative. And so we can start practices that probably I can't even imagine right now that incorporate these planetary health ideals into care, even with like new payment systems or new economic systems. So I think really just unleashing nurses and our creativity on this problem and these vast problems would be really effective. So I've just encouraged all of you to think outside of the box. Think of things that you're passionate about and how you can make a difference, and really think about starting your own thing, whether it's a nonprofit, a business, whatever it may be. Reach out to me. I'm happy to help.
Thank
That's my
you
elevator
so
pitch.
much, Dr. Ziegler. Between being a planetary advocate and entrepreneur, what a mentor you are for all of us in our practice. And I want to thank you again for making time for us today. And as always, be kind to yourself and be kind to others. Thank you.
Thank you so much for having me.
GAPNA Chat is owned and produced by the Gerontological Advanced Practice Nurses Association. All rights reserved. No portion of this podcast may be used without written permission. If you are an advanced practice nurse caring for older adults and want to further your career, GAPNA encourages you to sit for the Gerontological Specialist Certified exam and earn your GSC credential. This expert certification distinguishes APRNs with the knowledge and experience to manage the complex health needs of older adults. Visit gerocert.org to learn more. Dr. Carol Ziegler is a professor of nursing at Vanderbilt University School of Nursing in Nashville, Tennessee, and is a co-founder of the Climate, Health, and Energy Equity Lab. Dr. Cassandra Von S. is the Nurses Improving Care for Healthsystem Elders Niche Coordinator, Geriatric Oncology at the Moffitt Cancer Center in Tampa, Florida. She is a member of the Gerontological Advanced Practice Nurses Association communication team and is a host of the GAPNA Chat podcast series. For archived episodes of GAPNA Chat and to learn more about the Gerontological Advanced Practice Nurses Association, visit gapna.org. You can also subscribe to GAPNA Chat everywhere podcasts are found.